like the power of the nurses, because the power of the nurses won't stop. Ain't no power like the power of the nurses, because the power of the nurses won't stop. Ain't no power like the power of the nurses, because the power of the nurses won't stop. Ain't no power like the power.
We're taking a stance now to change the status quo for the future, to try to help everybody the best we possibly can. Because if you don't take a stance at some point in time, nothing gets changed.
The balance of power is so stacked against workers in America today. And we're seeing an example of that today at the hospital, where hospital management is looking at locking out nurses who are standing up for such basic things as health insurance for nurses at a hospital, transfer language, which is a very fundamental worker demand, as well as patient-to-nurse ratios. Stand strongly in support of the nurses, the good work they do, and the stance they're taking today.
I have two kids, both of whom were born at Eastern Maine Medical Center, one of whom has received treatment at Eastern Maine Medical Center. And the absolute glue that holds the place together is the nurses. They are the people who give you the treatment day in, day out. They are the people who show up at your bedside when you need them. They are the people who, when as a parent, you're going crazy because your child is in pain or is in some form of distress, they are the person who's there to calm you down. And yet they are allowed to be there in numbers, ratio numbers, that exceed what I was allowed to be in ratio to when I was waiting tables.
I get patients down pre-op that haven't had a bath in 3 days. Okay, they're having surgery. That's actually an infection control thing at that point in time. I'm not writing people up, I'm giving the person the bath, because I want those people to have that care. Actually have about 7% less staff than we did at the beginning of the year, with about 14% more overtime and extra time being worked. And yes, nurses are volunteering to do that. Why are they volunteering to do some of this extra and overtime? Because they know if they don't, the patients aren't going to have enough nurses. And even when they are there, there's still not enough nurses at times.
They're being forced to strike and also undergoing a lockout for very simple, fundamental demands. And this shows how much the balance of power is tipped against workers in this country now.
It's not even 6:30. I'm with my patient, and they said, no, you need to leave right now.
Can you imagine those managers that haven't been out on the floor forever, out there trying to take care of a code by themselves until the others come in? Really?
Yeah, I just think that it's horrible. I'm sick about having to leave my patients to be able to give them better care. And that's what it's about for me. It's never been about money.
I'm here to support the nurses. I want good care when I go in there.
That's serious, huh? 9 patients. That's ridiculous. We're not even supposed to have more than 2.
And now we've gone this far, and we're not going to give up. We're not going to back down to them. They are not going to win this. This is ours.
We just had to wait 45 minutes in the corridor between CCU and ICU to get escorted out by the security, even when one nurse said she needed to get home because she had 2 children, 10 and 3, by themselves, because her family was leaving for Massachusetts or somewhere today, and they would not let her leave.
Patients' families were getting upset because the security guards were walking around every 15 minutes, 2 at a time, keys clinking in their pockets and whatnot, and they didn't know what was going on, and they asked, what was going on, and so we asked them to please stop, and they said they couldn't.
I would just like to take a moment for our patients and for the community, and for our nurses who just left, and the ones that didn't get to go in today. Just bow your head for just a moment, please.
My name is Jackson Sparkman, Jackson-Sparkman. I'm supporting my grandma, Jo Ann Nevels. She has worked here for over 30 years, and she has worked for Safe Staffing all the time she's been here, and I will support her any way I can.
I'm a husband of a nurse, That's the most important thing. That's the most important reason I'm here. I'm also president of the Maine AFL-CIO. And I'm here supporting the nurses because 14 years ago, my wife actually left nursing. In a way, she left it. She's now a school nurse. But she loved hospital work, but she could not stay there any longer. It was every night when she came home, sometimes it'd be tears, but stressed out all the time. And it was about staffing, completely about staffing.
I personally am here because I've had 2 wonderful experiences in this hospital that was due to the nurses. I was here for a cardiac care unit, and the nursing staff here was wonderful, and this is my personal way of saying thank you to them for the great care that they gave me. Now, this was back 8 years ago, and they had the proper staffing. I'm worried now if I came back today, if I would get the same type of care.
I lost my sister this June unexpectedly. She went to the emergency room and passed away. And it was the nurses who helped us, the nurses who found us a room to go sit in and wait for the rest of our family, who held our hands, who comforted us, you know, and I think that's what this whole strike is all about, is nurses really doing the nursing job they're supposed to do and want to do, and getting the staffing so they can really treat people instead of, you know, treating people like dollar signs, moving them in and out as quick as they can.
Whoa, 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 caught in a bad contract. Whoa, 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 caught in a bad contract. Whoa, 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 caught in a bad contract. Whoa, 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 caught in a bad contract.